Please welcome Leader of the Ontario Greens, Mike Schreiner.
Bonjour tout le monde. Good morning, everyone, and thanks for joining us. Before we begin today, I'd just like to give a big shout out to all the municipal crews who are out snow plowing, digging people out, the transit drivers who are helping people get around, and all the folks like me who helped shovel their elderly neighbors' sidewalk today. It's been heartening to see so many Ontarians out helping each other deal with today's snowstorm. I'm speaking to you from my home in Guelph, which is on the Treaty 3 lands of the Mississaugas of the Credit First Nation. And I'd just like to take a moment today to reaffirm the Ontario Green Party's support for the Truth and Reconciliation process as we work to dismantle the legacy of colonialism and systemic racism in our society. As kids head back to in-class learning this week, student mental health must be a top priority. The past 2 years of uncertainty and isolation have been so hard on our young people. Youth rates of depression, anxiety, and eating disorders are sadly increasing. The public health crisis has presented an unprecedented experience for our youth. Seeing loved ones get sick or losing their lives in some cases to the virus, the fear of bringing the virus home or getting sick themselves. These are real fears that young people are facing. The Ford government's slow pace and failure to take decisive action throughout the pandemic has contributed to the constant closure of schools, and this has added more stress for children. And there is a heightened level of anxiety as in-class learning resumes during the Omicron wave. There is no doubt that public health measures have been important in curbing the spread of the virus, but we cannot ignore the mental health impacts of the last 2 years on our kids. As kids head back to school, doctors are warning of an unprecedented wave of student mental health requests. Ontario needs to do everything possible to help our youth navigate this. But unfortunately, wait times for access to youth mental health services have gotten worse under the Ford government. For years, we have called out the government penny pitching on youth mental health care. You know, the $1.9 billion from both the federal and provincial governments over 10 years for the province's entire mental health plan was not enough pre-pandemic to address the need, and it certainly isn't enough given the mental health crisis that is increasing because of the pandemic. Wait lists were already 18 months for youth to access mental health services pre-pandemic, with some kids waiting up to 2.5 years for help. And it's only gotten worse since the pandemic started. The bottom line is everything is not okay. Help should be available when and where kids need it, not months and years down the line. Most people know how hard it is to admit when we need help, how hard it is to ask for help. So just imagine how a child must feel when they are facing crisis. And it's on us to ensure that our youth have the help they need when and where they need it, that it's equitable, affordable, and accessible. We must remove the barriers to accessing mental health supports. We have to do better. Access to mental health services should not be a luxury for our kids. It's a core necessity because mental health is health. And that's why the Ontario Greens are calling for increased funding to community child and youth mental health services by a minimum of $150 million per year, in line with recommendations from Children's Mental Health Ontario, to ensure that no child or young person waits longer than 30 days for mental health care. Investments to ensure the mental well-being of all students are supported, and that students can seamlessly connect to community mental health professionals that are located at or near schools. They need someone to talk to. Help needs to be directly available and easily accessible. Expanding support for telehealth services and 24/7 crisis hotlines, texting and live chats, including investing in providers designed specifically for BIPOC communities to help reduce wait times. Expansion of youth wellness hubs across Ontario, so all youth in all communities have access. If the last few years have taught us anything, it's that we need a more caring Ontario. We need an Ontario that supports and uplifts everyone. Now is not the time to be spending billions on unnecessary highways. Instead, now is the time to invest in a caring Ontario, a time to invest in our children and investing in the people of Ontario, ensuring that we do everything possible to uplift them, to help them recover, to provide the assistance they need, especially when they are in crisis. And we cannot ignore the mental health crisis. So I implore the Premier to listen to our ideas, to work together across party lines to address the mental health crisis in our communities, especially affecting our youth. Thank you. Merci. I'm available to answer any questions.
Thank you, Mike. We'll now move to the Q&A portion. Media with questions, please use the raise hand function and I will call on you. To start, we'll do one question and one follow-up. I had a message here from Wyatt Sharp. So while the others use the raise hand function to ask a question, Wyatt, go ahead and ask your question. Thank you.
So hi there, Mike.
Hi.
So the federal government unveiled a new app called Pocket Well that they're using, and it has various sections. They have one section for adults, one section for youth, one section for frontline workers, one section for Indigenous peoples, and it goes on. And it's basically just a resource, as they describe it, that you can use if you need immediate mental health support. I'm just wondering if you've heard of this app and whether or not you think this app should, or just I guess how you think this app should be used at the provincial level. Do you think the government should try to help with further development of this app? Just speak about that a bit.
Yeah, no, I've been supportive of online mental health tools and the various apps that have been brought forward. Had a real opportunity here in Guelph where Compass brought out online app a couple of years ago, that very useful tool. So absolutely are supportive of online mental health supports and services. Certainly appreciative of the fact that the federal government has contributed and will be contributing $1.9 billion over 10 years. But the bottom line is that wait times for youth mental health services, especially accessing a professional, are far too long. And I've had far too many conversations with constituents who have been in crisis and then had to wait months, and in some cases even more than a year, to access mental health supports. And so I think the Children's Mental Health Ontario has put forward, I think, a very reasonable and affordable recommendation of the kind of funding resources that are necessary to ensure that we reduce wait times for children's mental health services to 30 days or less. I think that's vital pre-pandemic, but it's especially essential given the rising rates of anxiety, depression, and other mental health challenges that youth are facing as a result of the pandemic.
And you mentioned kind of wanting to lower it to the wait times to below 30 days. Obviously, that's with a professional, with
Yes.
apps like the Pocket Well app and resources like Kids Help Phone. You get immediate support, but obviously you're talking a bit about like more professional support. So just obviously that would require more funding. Where are you? Are you just asking the federal government and the provincial government to collaborate, or just for the provincial government to invest the funds on their own? Just speak about that.
Yeah, so the $150 million a year investment, we're calling on that from the provincial government. Certainly, as any provincial politician, we will always say yes to increased funding from the federal government. Obviously, the federal government has more fiscal capacity than the provincial government, but I think this is a vital investment, and it can actually help save money. And so, just on the apps, one of the advantages of having online mental health resources is that it can provide supports for young people before they reach a crisis state. But the bottom line is we have a number of youth who are facing a mental health crisis and not able to access services. Children's Mental Health Ontario estimates up to as high as 200,000 children in Ontario not able to access the professional supports they need. So this is a crisis that requires immediate investment. And I think that is an important investment, not only to improve youth mental health and improve the quality of life for youth, but to also take stress off of our other healthcare resources, because we want to provide the support youth need before they reach a crisis situation.
Thank you. Next up, we have Adam Donaldson. Adam, please unmute yourself and go ahead.
Thank you. Good morning, Mike. Happy snow day. You're talking this morning about mental health and making those investments, and I understand that. I'm also thinking about the backlogs and procedures. We're looking at massive healthcare investments just generally. There's a budget consultation underway. I guess looking at a total package, what do you think the province needs out of this budget process to ensure proper healthcare coverage, not just in the mental health capacity, but across all aspects of healthcare?
Yeah, it's a great question. I mean, we need to be shoring up our entire healthcare system. And one of the points I'm making today is that mental health is health. And that especially, I've had so many conversations with students and parents and educators last week in particular, where there's just a heightened level of anxiety right now for students going back to in-class learning. And we want to make sure those mental health supports are there for them. Absolutely, we need to be shoring up our healthcare system. And in particular, we need to be addressing the health human resource capacity issues Ontario is facing, especially the shortage of nurses. We are not going to provide the healthcare Ontarians need, nor are we going to be able to address the surgical backlog that many people in Ontario tragically are facing if we don't invest in health human resources. And that's exactly why the Ontario Greens months ago put forward a plan to retain and recruit additional nurses in particular, starting with repealing Bill 124. I can't tell you how many nurses who have just said, you know what, being overworked, underpaid, underappreciated, working in the kind of working conditions they're in. If you're going to tell us, we can't see an increase in our total compensation package beyond 1% over 3 years, it's just not worth it. And there's a mental health component to this as well. Numerous studies have shown, and surveys have shown, that nurses themselves and other frontline healthcare workers are facing a mental health crisis. And when you talk about access to mental health services, that comes through benefit packages. And so, that's a part of the compensation package as well. So it's not only about paying nurses what they deserve, but it's also ensuring that they have the a full compensation package to access supports like mental health supports. And then I'll just close by saying, yes, we need more bed capacity, more physical capacity within our hospitals. But if you don't have the staff and the people to service those beds, then Ontarians aren't going to get the care they need. And one of the ways that we can quickly increase the supply of nurses is to fast track accreditation of internationally trained nurses. I know the province, after months of pressure from people like myself, finally has started to move in that direction. But there's still far too many internationally trained nurses who could be quickly up to speed and able to provide services in Ontario that are not. And I feel like when the government put forward legislation last fall around international accreditation for things like construction workers, nurses and frontline healthcare providers should have been included in that legislation as well.
Do you have a follow-up?
I do have a follow-up. It's on a slightly different topic. Next week, per previously announced, we should see the economy start to reopen again. What's like your advice in terms of that, how that should happen? What would you recommend to the government in terms of assuring that's a smooth process?
Well, I mean, first of all, the government should base their decision making on data and metrics. And I know that's hard right now because the testing system is overwhelmed, but we need to be looking at hospital capacity and ICU capacity as we make those decisions. One of the things that is very frustrating for me, and I know many small business owners, and I've talked to so many small business owners and employees over the last week, is that the government needs to quickly get financial supports out to those small businesses that are barely hanging on, to one, keep those businesses alive and keep the jobs available. And they need to make sure that a lot of the challenges that made it difficult for many small businesses to access the Ontario Small Business Support Grant are addressed as they roll out funding. I can't tell you how many small businesses, particularly gyms and restaurants, who've said, we can't wait weeks. We need help now. We need help, especially before February 1st, when the next rent payments are due. I think the province could alleviate some of the anxiety by bringing back in the commercial eviction ban that I, so pushed hard for back in the early days of the pandemic. And then finally, we've been calling on the government to really acknowledge that COVID is airborne and bring in the precautions that are needed, particularly in vulnerable workplaces. So making N95 masks not only available in healthcare settings and schools, which is in long-term care, which is absolutely necessary, but also in those workplaces where physical distancing is a challenge. And to really work with employers to mandate ventilation and air quality upgrades as well, because we want to avoid community spread. And one of the ways that we've seen historically community spread is through vulnerable workplaces where physical distancing is a challenge.
Thank you. Next up, we have Sneh Dougal. Sneh, please unmute yourself and go ahead.
Hi, good morning, Mike. Thanks for taking our questions. My first question is just regarding schools and what we're seeing today. So, obviously a lot of boards have closed schools, but we're seeing some differences in terms of whether they're directing staff to teach remotely, or if it's considered a snow day and students are off. Just want to get your thoughts on that. There is some criticism, including from unions who are not happy about being directed last minute to prepare remote learning. Or remote learning lessons. So just want to get your thoughts on that, about whether, this type of thing should be left up to school boards, or whether you think there needs to be some kind of overarching provincial policy that addresses this.
Yeah, well, I mean, it's hard to have a one-size-fits-all solution because the capacity, different school boards are different and the conditions are different. I think I do share the frustration that many parents are experiencing today, where we had a fair amount of ample warning that a snowstorm of this magnitude was on its way. We certainly have shown that we have the capacity to provide online learning, and in those cases where that's not sufficient, I don't think that's acceptable, and I think the ministry needs to be pushing those school boards to do better. From my perspective, either make it a snow day and give the kids a day off, or provide high quality online learning, which we know we have the capacity to do. This in between that's happening in some boards is just not good enough.
Okay, thank you. And question on a different topic. We saw a new long-term care minister appointed. One, just wanted to get your thoughts on the new appointment. And the NDP is also calling for a dedicated minister that doesn't have other portfolios as Minister Calandra has. So just wondering if you support that call. Yeah, thanks.
Yeah, well, first of all, last week, I called on the government to act swiftly to replace Minister Phillips. We have a crisis in long-term care where 50% of our long-term care homes are experiencing outbreaks. I've called on the government to bring in the military to help. Our elders deserve it. Just the tragedy that so many long-term care residents have experienced in their homes is completely unacceptable. And to go through this again after what elders have been through is unacceptable. I do think the government needs a minister that can solely focus on this ministry because because elders are so vulnerable and we have a crisis. So we need somebody who is completely focused on making sure our elders are protected. And I've had so many phone calls with constituents over the last couple of weeks, and one of the ones that really sits with me is a woman who lost her grandmother to COVID on January 10th, and just the challenges the family faced in terms of making sure her grandmother had a booster shot, making sure her grandmother had the care and support she needed. And I know that story is being played out in so many families across the province right now. And we need the government to do more, and we need the government to do better, and we need the government to treat this like the crisis that it is. And that's why I've been calling for bringing in the military to help support our long-term care homes.
Thank you. Next up, we have Ahmed. Please go ahead and ask your question. Thank you.
Hi, MPP Schreiner. Can you hear me?
Yes.
Yeah, hope you're doing well. I interviewed Dr. Vivian Stamatopoulos over the weekend, and she said that it would be a big slap in the face if they dial it in with a part-timer after the appointment of Paul Calandra as the Minister of Long-Term Care. I'm wondering, and I think you did answer this with Sneha's question, do you think that the government needs to appoint someone different right now to handle the crisis? And also, what do you think needs to be on the to-do list for the upcoming minister? There's a big crisis in long-term care right now with outbreaks.
Yeah, well, I think we need a minister who's solely focused on long-term care. So whether that's Mr. Calandra or another individual, I would just say somebody who that's their only focus and they don't have other duties and ministerial responsibilities because we are in a crisis in long-term care. I have been calling for bringing in the military to help shore up our long-term care homes again. We simply can't have a repeat And we're well on the way to a repeat of the tragedy, especially that long-term care residents experienced in wave 2 of the pandemic. We need to make sure that we prioritize getting booster and vaccines into long-term care homes, meaning taking it to the homes. I'm hearing reports of elders who have not been able to access booster shots. And so we need to actually take them to the long-term care homes. We need to ensure that we have proper ventilation in our long-term care homes. And for those homes that should have received an upgrade, in the same way we're focused on ventilation in our schools, we need to be doing it in long-term care homes and get HEPA filters there. Get proper PPE, N95 masks, and other high quality masks in our long-term care homes. And quite frankly, we need to shore up the human resource challenges that people are experiencing in long-term care. Not only, and that's one of the reasons I've been calling for bringing in the military, but also we need to make pandemic pay permanent. This sort of on again, off again. I mean, I have PSWs reaching out to me saying that, they haven't received the pandemic pay they were promised last fall yet. So I don't know what type of bureaucratic glitches are affecting these particular PSWs and how widespread that is across the province. But at a time when, we need all hands on deck, we need to make sure that we're compensating the people who are there caring for our loved ones and making sure that they have the supports and resources they need to be able to care for our loved ones safely.
Thank you. I want to ask you about another topic, colleges. There's an ongoing labor dispute between the College Employer Council, which is representing the government's 24 publicly funded colleges, and the college faculty. The last negotiation that took place was in 2017. The result was a 5-week strike before the when government legislated faculty back to work. We just got a press release from the College Employer Council saying that they've asked the Ontario Labor Relations Board to conduct a vote with membership on the most recent offer. There seems to be, they're asking that there is no further labor dispute or labor escalation. As you know, the college faculty entered phase 2 of work to rule a few weeks ago. So I'm wondering what your response to this is, and what is there anything the government could be doing right now to further, alleviate what's happening?
Yeah, the bottom line is Ontario colleges, and I include universities in this as well, but I know we're focused on colleges right now, have the lowest per capita funding any province in the country. And that's led to precarious work situations and in many times inadequate pay, especially for college faculty. And so this is going to be an ongoing problem until the provincial government steps up and provides the funding necessary to support post-secondary education in Ontario. We simply can't keep seeing the provincial contribution going down year after year and not expect these types of labor negotiation challenges. So in my opinion, the provincial government needs to have a cash infusion into our post-secondary institutions so that we can demonstrate to faculty that we are going, as a province, going to start addressing the precarious work situation that we're seeing in our colleges and our universities.
Thank you. Just a reminder to use the raise hand function if you have a question, or you can just prompt me in the chat if you're not able to find the button. In the meantime, Wyatt has one more last quick question. So go ahead.
Hi again, Mike. So right now, Dr. New and Dr. Tam are announcing the approval of Pfizer's antiviral pill. I know at your last press conference, I asked you about this, and you said you would hopefully have a briefing with Dr. Moore soon on this topic. But now that it has been approved, as they are announcing right now, I'm just wondering if you have any idea as to how Ontario should distribute it. Right now, we're getting news that Ontario is going to be receiving about 10,000 of the antiviral pills. So I'm just wondering if you have any ideas as to how, the 10,000 should be distributed.
Yeah, well, one is it's good news that the approval's coming through, and the distribution should go to based on need at this point, especially because, as many of you've probably seen reports that hospitals across the province are experiencing shortages in medications used to treat COVID patients. And so I think at this point, distribution needs to be based on need. Where we have the most pressure being put on our healthcare system due to COVID-19 patients, and in those areas where we're seeing shortages of other medication, so we can alleviate that challenge that many hospitals across the province are facing right now.
Thank you. Just a reminder, for any last questions, please use the raise hand function or prompt me in the chat. I'll give a few seconds to give everyone a chance to do that. Okay, looks like no further questions for the time being. If you have any follow-up, feel free to reach out to me directly. And with that, I'll pass it back to you, Mike, to wrap up.
Thanks, everyone. I really appreciate you joining us today, and be safe if you're walking, driving today, obviously with the weather. And once again, just thank you to all those municipal employees, transit workers, others who are helping people navigate getting around communities across the province today. And I just want to close by saying to young people in our province that we care about you, we support you, and we're going to continue to advocate that we make schools as safe as possible for you to participate in-person, in-class learning. And we're going to continue to push hard that the financial supports are in place and that the people are in place to provide you with the mental health supports and care you need and deserve. Thanks, everyone. Have a good day. Be safe. Be well.